We're trying to go across the state prior to next week's special session to give a chance for legislators to ask questions, to state opinions. We're not here to ask anybody for a vote or to twist any arms. Obviously there'll be a time to ask for votes later, but this really is about information, about asking questions. Here's what motivated me. Like not all of you, but like some of you, I'm not a fan of the Affordable Care Act. I thought the president had a chance to do two things, and he took the easy bite. One of those was to expand and cover people who weren't covered, okay? Most of us think that that's a good idea. For people to have health insurance is a good idea. The question is, how are you going to pay for it and control the cost? So the Affordable Care Act did that. What it didn't do was address the cost side of the equation. And so it's almost like if you had, okay, this is the easy part of the news is expanding who we're covering. The hard part is, what are we going to do to control costs so that everybody, businesses, individual, and government, which increasingly pays more and more health care costs, don't continue to be swamped by the cost of medical care. And my issue with what they did was not that they tried to cover more people, it's that they didn't take that chance to put pressure on the different points of the system to try to control the costs. They missed their chance at the bite of the apple when it happened to control costs. Can we do something that would do that? And that's why we worked to come up with this plan. Medicaid is by its very definition a free product that you can't deny service to for any reason. And so there's a lot of healthcare professionals in this room would tell you, so how do you incentivize healthy behavior when something is free and you can't deny care for any reason? So that's what we've been struggling with and trying to come up with something that would work in line with that, where we really would have incentives on the user side and on the provider side toward better outcomes and lower cost. I think everybody understands that healthcare is a difficult issue and it's complex, number one. Number two, the folks who say this is just Obamacare, it's Obamacare, that's an easy message to pass on. That's why we're doing this, going around the state saying, here's what's different about this plan. This is not easy. Believe me, I understand the political contentiousness of it. I fully get that. And I understand the complexity. When you start dealing with healthcare, there's nothing simple about it. There is nothing simple about it. But I think that's part of what we all came here to do. We all came here to provide answers and to solve problems. And we have a problem both around healthcare costs and around real humans that you described in very real ways that can get caught without coverage and ruin their lives. And so I'm trying to produce a solution that I think can address both of those for Tennessee.